so which was a reasonable number. Of those who had been tested, 2/3 knew they were negative. 1/3 couldn't remember what the result was, and 42 said they knew they were hepatitis C positive. So that's it, but it is self-reporting. The system works so that every interaction that you have with that client, you actually do record just the needles for 6 months or whatever the intervention you're doing. And every 6 months you revisit that front page just to see, well, of those who said they hadn't been tested 6 months ago, are they tested now? Of those who hadn't been vaccinated, are they vaccinated now? Of the 1,500, 909 had hepatitis B vaccination in our prisons. So, you know, prison can be a very positive experience in Wales because only something like 112 others had ever been vaccinated elsewhere. So it would appear, although as I said it is self-reporting, that in Wales, if you're an intravenous drug user currently and you've been vaccinated, you know, you have a 90% chance that you had that in prison, not in our drug services. So it will be useful for us in time. One other work stream that we're working on is prevention, education, and awareness raising. That's a very good work stream because we have some of the universities on board that are taking it forward very fast. Needless to say, we're not inventing the wheel. The Royal College of General Practitioners, there's lots of really good education material out there. What we're doing is breaking it down to 2 levels. One, for all individuals working with those currently potentially at risk, and level 2 then for people who need to know a little bit more. Now, you know, I'm very keen that the level 2 is targeted at our GPs, because I would like our GPs not necessarily just to think bloodborne viruses, but to think, you know, risk behaviours for liver disease. You know, when I come into the clinic, you say to me, well, you don't look overweight. That's true. You know. Tell me about your alcohol. And you know, back in the 70s, did you have a jolly time, and what were you up to, so to speak? Now that's all that we do. You know, I mean, I do think, you know, and we are actually, so actually our level 2 is not just around bloodborne viruses, because it's very hard for me to actually do something and educate GPs just about bloodborne viruses. And I think actually this is liver disease here, and I want them to, you know, to say, if your waist, you know, if your waist is above 32, you know, do something or not. And it isn't. So that's the ongoing work we're focusing on is improving bloodborne virus services for offender populations in Wales. We've just had approval from all the various bodies to do a project. We've called it research because, believe it or not, it was the easiest way to do it, to roll out dry blood spot testing in all our prisons in Wales. So we've only got 5, so Matt Hickman has recruited Bristol prison into that study, and all our female prisoners are managed in England, so we're working currently with 2 of the PCTs in England to see if we can test our female residents there. We're doing it in a stepwise approach because we haven't got the clinical networks that we might like in place. So I'm going to fly through the rest. As I said, we're rolling out the dry blood spot service in all our drug users. Our intention that every intravenous drug user is offered the test annually while they're in treatment. I mean, obviously, provided they're not that positive already and in care. And we've piloted in North Wales. It's been successful. We've just started that on the 1st September. Along with the dry blood spot, we are collecting enhanced surveillance data as well. So any individual, it's voluntary, the enhanced data, surveillance data, so they will tell us a little bit about their risk-taking behaviours. So that is then collated by CDSC. We're strengthening our diagnosis and surveillance, as I've said, but I want to talk about the treatment and care pathways. Most of the 1.33 million, apart from the 148,000 they gave us, goes to 7 treatment centres in Wales. Because you know, we can't do anything unless we have that network of individuals who are skilled, who can support our drug services. So we had a model like this, but basically what we've invested in, each of the 7 treatment centres in Wales have had the money for 3 specialist nurses. Now it was for them to decide whether they wanted them all, whether they wanted bloodborne virus nurses, whether they wanted some CPN support perhaps, or how, you know, it was up to them to kind of decide what that configuration would be. We funded extra hepatology sessions in each of the 7 centres and extra psychiatric sessions in each of the 7 centres. And we also funded an admin post because I do recognise data collection is variable. We want them on board to collect some meaningful data for us. And that's where we're up to. I think it's a lot of investment. You're talking about 21 nurse specialists of some kind, along with your extra hepatology sessions and extra psychiatric sessions. But I also feel that 5 years down the line, I want them to be doing more than bloodborne viruses. I want them to be the backbone of the we have apparently teenagers in Wales the fattest in the UK. So what does that say about what's going to happen to liver disease in Wales 10, 15, 20 years from now? So I would want these nurses and this network to be the basis of a liver programme for Wales, that's wider than bloodborne viruses. Because I would, if my bloodborne viruses aren't reducing in Wales, we'd have failed. Our prevalence is low. It's 40% in our cities, it's 1% in Merthyr. We tested 100 intravenous drug users from Merthyr and we found 1 positive. We followed up 70 of those a year later, they were still negative. So in some areas, hepatitis C isn't a problem. It clearly is in Cardiff, Newport, Swansea, but in other areas it's low. So if I don't make a difference by testing them all annually, by having a network of care which is community focused, 5 years down the line, we wouldn't be able to ask for money for anything. Just would have failed. So that's where we're up to, basically.